Epilepsy is the medical term that is given by a healthcare provider to a person who has 2 unprovoked seizures or 1 seizure with a strong possibility that they will have another. Epilepsy is a disease of the brain characterized by a predisposition to generate epileptic seizures and by the cognitive, psychological, and social consequences of this condition. Epilepsy affects people of all ages and all cultures. Epilepsy is a spectrum disorder with varying degrees of seizure frequency, type, and severity. Some children have good seizure control, while others have seizures that are persistent and severe. Some children outgrow their seizures, and others do not. It is estimated that 1 in every 100 school-age children has epilepsy. The human brain contains billions of specialized cells called neurons, and the signals these cells transmit and receive are at the heart of how the brain functions. Everything we do, think, say, and feel is the result of the electrical signals that are generated by the neurons in the brain. The brain is divided into sections called lobes. Each area of the brain performs a role or function. There are different areas in the brain that control sight, smell, language, touch, taste, memory, emotion, and movement. Most of the time, the neurons in the brain and the lobes work together and function normally. Sometimes, the neurons in the brain don't fire properly, and when they misfire, it can cause a seizure. A seizure is an event. It is the sudden burst of electrical energy in the brain or a misfiring of neurons. During a seizure, brain function is interrupted temporarily. The neurons will resume their normal function once the seizure comes to an end. Not all misfiring neurons cross the same area of the brain. For this reason, not all seizures look the same. If the misfiring neuron is in one hemisphere or one part of the brain only, we call this a focal seizure. Focal seizures are classified into aware or impaired awareness. A student who is aware during a focal seizure will remember all of the events that occur during the seizure. If the student is unaware, they will have an alteration in consciousness. In a focal seizure, the student will not fall down to the ground and shake. They may wander, or they may pick at clothing or smack their lips. Their face may twitch, or a hand may jerk. Often they are very disoriented and confused after this type of seizure. In a focal seizure, the student may experience an unusual sensation, feeling, or movement. Some people call this an aura. They may see, hear, or smell something that isn't there. They may have a sudden jerky movement of the arm or leg. They may complain of a stomach upset, dizziness, tingling, or burning sensation. If the misfiring neuron crosses both hemispheres of the brain, we call this a generalized seizure. In a generalized seizure, the student will temporarily lose consciousness. One type of generalized seizure is an absence seizure. This seizure is often referred to as a staring spell or blank stare. It is often mistaken for daydreaming or inattention. In an absence seizure, the student will not fall to the ground and they will not shake, but they do temporarily lose consciousness. This type of seizure is short, maybe only 4 to 20 seconds, and happens multiple times every day. One student shared that when she has this type of seizure, she feels like a computer when the screen freezes. This is an example of a child having an absence seizure.
Absence seizures can be mistaken for daydreaming. One of the hallmarks of absence is that the seizures happen many times in a day. Sometimes they're so fleeting, they're easy to miss. This boy is having frequent but very brief episodes. You can see his eyes flutter up. He's out of touch. Then he becomes fully aware again.
Another type of generalized seizure is a tonic-clonic seizure, often referred to as a grand mal or convulsive seizure. In this type of seizure, the student may begin by making a sound or a groan and then fall to the ground and shake. The student's breathing may be shallow and irregular during this type of seizure. Their lips may turn blue. The tonic phase is the stiffening of the muscles. The clonic phase is the shaking or the jerking. After this type of seizure, It is normal to want to sleep since the student will feel exhausted and confused. They may also feel very embarrassed. These seizures happen without notice, which is frightening for the teacher and the class. The best way to reduce this fear is to be trained, to know what to expect, and to know how you can help. This is an example of a child having a generalized tonic-clonic seizure.
Generalized tonic-clonic seizures, often called grand mal. They affect the whole brain and the entire body. The tonic phase is the stiffening of the muscles. Then the jerking movements begin, the clonic activity that you see here. A tonic-clonic seizure rarely lasts more than a few minutes. A person having one isn't conscious and won't remember what happened. The skin may become pale. Breathing may seem shallow or labored. Sometimes a child may lose bladder or bowel control or vomit as the seizure ends. These seizures may look painful or even life-threatening, but they are not. They end naturally after a minute or two.
There are other types of generalized seizures, like a tonic seizure, where there is an increase in the muscle tone, and an atonic seizure, where there is a loss of muscle tone, or a myoclonic seizure, where there is a sudden muscle jerk or jerks. Seizures can be frightening because they often happen without warning. The good news is that they are rarely medical emergencies. They are also very common. In fact, 1 in 10 people will have a single seizure in their lifetime. Knowing what to do when a person has a seizure and when a seizure is a medical emergency is a great life skill that can be taught to the whole class. The first seizure is always a medical emergency because you do not know why it is happening. If you know the student has a diagnosis of epilepsy, you can follow these rules. Step 1. Stay calm. When someone has a seizure, you need to stay calm. This is very important since people around you may panic during a seizure because they do not understand what is happening and because the seizure happens so suddenly and without warning. Step 2. Protect from injury. Move the student away from any sharp or dangerous objects. Turn them on their side into the recovery position. Loosen anything that is tight around their neck, for example a scarf. Put something soft under their head, like a sweater or a coat. Step 3. Do not restrain the student. You could hurt the student if you hold or pin them down, and it will not stop the seizure. Step 4. Do not put anything in the mouth of a student having a seizure. The student cannot swallow their tongue, and you risk injuring them if you stick an object in their mouth. A student may bite their tongue during a seizure. You may hear sounds like the student is gagging. This is difficult for you to hear, but you need to know that a person cannot swallow their tongue during a seizure. Step 5. Always time a seizure. If a seizure lasts less than 5 minutes, it is not a medical emergency. After a seizure, the student may appear disoriented and want to sleep. This is normal. A seizure is a medical emergency if it is a first-time seizure, lasts longer than 5 minutes, if the person is injured, if the person is pregnant, or if the person has diabetes. A person with diabetes may experience a seizure as a result of high or low blood sugar levels. A seizure is also a medical emergency if it occurs in water. If a second seizure occurs before the student has fully recovered, or if regular breathing does not return when the seizure ends, this is also a medical emergency. A seizure is a medical emergency if it does not stop after 5 minutes. Some children are given a prescription for a rescue medication if there is a history or risk of the seizure lasting longer than 5 minutes. Rescue medications are used to stop seizures that may not stop on their own. They do not replace daily medications. They are used to prevent emergency situations from occurring. The rescue medication is typically a pill that is placed in the cheek if the seizure has not stopped within 5 minutes. The pill is placed between the gum and cheek where it is dissolved quickly into the bloodstream. This pill is used to stop the neurons from misfiring. Children with rescue medications will have a plan of care. For each student, the effect a seizure has on their academic abilities and brain function will be different. 2 children of the same age, sex, and on the same medication with the same seizure type may react differently to seizures. When seizures consistently begin in a particular area of the brain, functions controlled by that part of the brain can be affected. Reading, math, and attention are complex processes that involve many parts of the brain. The student with epilepsy has an invisible condition, and depending on where the seizures originate in the brain, they may have impairments that affect their cognitive, social, emotional, and physical well-being. The epileptic seizure is just the tip of the iceberg. Below the surface, the student with epilepsy is dealing with the cognitive, psychological, and social consequences of this condition. These are the hidden features that impact the well-being for students with epilepsy.